I've broken this down into an aging cycle for human beings based upon levels of inflammation and the levels of athleticism or how well their body will perform. In the red section here is a frank inflammation. That means that the patient is actually inflamed to the level of which their brain can sense they are in pain. Now, why do I say that? Now, we know that systemic inflammation is something that we can't feel. It must be measured. So once the patient is actually in pain, the levels of inflammation are very high. And the patient, every step they're taking is actually releasing high levels of inflammation that in concentration levels that can be felt by the patient. Now, maybe I have a back pain with a hip pain, and I have a slight foot pain. I go to the doctor for a back pain, and then you say, do you have any other pains in your body? Yeah, my foot hurts once in a while. It seems insignificant. However, the levels of inflammation is not the determining factor on how we should treat the patient. In other words, we're going to address all of our therapy to the back. I'm going to tell you it's a big mistake because the body doesn't work that way. The body is actually a giant spring mechanism, and the problem with the back pain that's not getting better is that something is in the way of the healing process. And the most likely area for that to happen is the most likely area that is affected by something that's unnatural. And that unnatural thing is wearing footwear. Footwear binds the human spring mechanism and sets off a chain reaction that runs right through the foot. There's 3 floors in the foot. Now that's the arch mechanism. That's where it springs. Subtalar joint, ankle mortise, knee, hip, back. All the way through that entire area must be evaluated in order for us to do a really good job of determining what's wrong.